This is Andrea Kane, and I'm here to talk to you about HIT 452, Statistics and Data Analysis, for week number 5. We are on chapter 6 and 7 this week, and if you look at your syllabus, you can see we have all sorts of unit objectives, 9.5.1 through 9.5.13 and 9.7.1 through 9.7.8. If you'd like to take a look at your textbook, we're going to be starting here on page 87. This week, it's all about mortality and autopsy rates. Mortality rates are in chapter 6 and autopsy rates are in chapter 7. So there'll be 2 lecture videos for this week. All right, learning objectives according to the book are to calculate all the different mortality rates, contrast between anesthesias, and differentiate between a direct obstetrical death and an indirect obstetrical death. So what is death? Death is a type of discharge or disposition. Any data representing total discharges includes deaths for that period. Deaths are always assumed to be included in the total discharges unless otherwise specified. So you've got to watch out for that. Deaths are included unless it says otherwise, either in your formula or in terms of the information. Deaths of newborn inpatients are included in the, if they are included in the numerator, then all discharges of newborn inpatients must be included in the denominator. Newborns are included in the gross mortality rate unless a facility chooses to calculate their rate separately. Patients who are dead on arrival are not included in the hospital mortality rates because those patients were not admitted to the hospital. They were dead on arrival. Patients who die in the emergency room are also not included in the hospital inpatient mortality rate because they were not admitted. Patients who die in the hospital while an outpatient are also not included in the hospital inpatient mortality rate. So that means if they're an observation patient and they expire, they're not included in that inpatient hospital mortality rate. And of course, DOAs are never included in any hospital mortality rate, inpatient or otherwise. And then those that are in the ED, those are also calculated separately from inpatient mortality. Fetal deaths are also not included in the hospital mortality rate. They are calculated separately. Mortality rates ordinarily are very small, so most calculations ask you to go out to the second decimal place, so to the hundredths, and you always want to put a 0 in front of the decimal if it's going to be less than 1%. So let's take a look at mortality rate. The hospital mortality rate is the proportion of inpatient hospitalizations that end in death, usually expressed as a percentage. If you look at page 88 in your book, example 6.1 is really easy to follow and shows you exactly how to calculate gross mortality rate. Moving on to case fatality rate. This is the total number of deaths due to a specific illness during a given period of time divided by the total number of cases during that same period. There are 3 examples. 3 examples of this on page 89, example 6.2, 6.3, and 6.4. Those are all really good to walk through to help you see how this formula works. Net mortality rate. This is different than gross. Remember, gross is total, everything. Net is only a portion. Net mortality rate excludes deaths under 48 hours. So that's the difference between net mortality rate and gross. Gross includes every single death. Net mortality is only looking at those that are 48 hours or greater. It does include newborns. It is often requested by various reporting or accrediting agencies and is also known as the institutional mortality rate. And how do you calculate that? Well, here's the formula. Now, looking at example 6.3, exercise. This is an important difference. Exercise 6.3 on page 91. It gives us the data on deaths. It says in the table There are total adult children live discharges 409. Total adult and children death, there are 2 that are less than 48 hours and 5 that are 48 hours or greater. There were 68 total newborn live discharges, and in terms of total newborn deaths, there was 1 less than 48 hours and 1 48 hours or greater. So how do we do net mortality rate? Because we've got to pull out those that are less than 48 hours. All right, so we have a total of 7 adult child deaths. We're going to add to that, because remember, in net mortality, you include the newborns. So we're going to add to that our 2 newborn deaths. That is a total of 9 deaths. Now we need to figure out how many of those were less than 48 hours because we have to pull those out. Remember, net mortality, pull out those. So we had 2 adult children that were under 48 hours and 1 newborn. So that's a total of 3. So 9 minus 3 equals 6 deaths, and that's going to be our numerator. Now for the denominator, we're looking at discharges, and remember the discharges include deaths. So we have 409 live discharges, plus we have the 7 deaths. That equals 416 total discharges. Then we have 68 newborn live discharges plus 2 newborn deaths. That's a total of 70 total newborn discharges. So we take 416, we add 70 to it. That gives us 486 total discharges, including deaths. But we have to pull out those deaths that were less than 48 hours. Remember, we have to do that for numerator and denominator. And we had 3 of those. So 486 minus 3 gives us 483 total discharges, including deaths, excluding those that are less than 48 hours. And that is now our denominator. So 6, which was our numerator, divided by 483, which is our denominator, gives us a 1.24% net mortality rate. Okay, that's how we get there. And that was exercise 6.3 on page 91. Not example, but exercise. Okay, so moving on. Post-op mortality rate. This refers to the number of deaths that occur after an operation or a surgical procedure has been performed, also known as the surgical mortality rate. There's example 6.6 on page 92 that walks you through that and does a really nice job of showing you how that formula works. So continuing on with the post-op mortality rate or the surgical mortality rate, includes the ratio of deaths within 10 days after surgery to the total number of patients operated on during the period. And then this just goes through and kind of explains surgical operation, surgical procedure. Make sure you know your definitions and your formulas. That is just so critical in this class. All right, anesthesia mortality rate. This is the ratio of deaths caused by an anesthetic agent during a period as compared to the number of anesthetics administered. Anesthesia deaths occur so very infrequently that some hospitals might choose instead to evaluate the relationship between a death and a specific anesthetic. There are 3 major types of anesthesia. There's general, regional, local. Spinal and epidural are examples of regional anesthesia, in case you were wondering about that. If you look on page 94 in your textbook at example 6.7, that's a really nice one to walk you through how this formula works. Maternal mortality rate. This is the death of any woman from any cause related to or aggravated by pregnancy or its management, regardless of duration or site of pregnancy, but it cannot be from accidental or incidental causes. So for example, if a pregnant woman had a motor vehicle accident, that would not be a maternal mortality rate inclusion. Or if she had a slip and fall accident that resulted in death. It has to be related to or aggravated by the pregnancy or its management. And And then it gives you an example that an incidental death would also include a suicide or homicide. Those don't get included as well. Direct versus indirect obstetric death. Direct means it's directly due to the pregnancy, that maybe they had some type of fluid embolism. An indirect cause would be that maybe she had type 1 diabetes and that was the cause. So again, when you're thinking direct versus indirect, be thinking about what was involved in the pregnancy and the death. When the rate's computed, hospitals usually classify only direct obstetrical deaths as maternal deaths. They very rarely do the indirect ones. That does include, the maternal mortality rate does include prepartum, which is not delivered, as well as postpartum cases. So prepartum is antepartum, it's before the birth. Postpartum is after the childbirth. Researchers use vital statistics for public health and policy studies. They use a number other than 100 in the numerator because they are not interested in determining percentages, but rather the number of times something occurs in the population. And so when you're talking about vital statistics, typically they're using 100,000. Sometimes they'll use 10,000, but usually it's 100,000. And your book talks about this on, let's see, what page is it? I had it in front of me, sorry. I lost it. About on page 95, top of page 96 is where it talks a little bit about this. All right, so the maternal mortality rate, the formula again is typically 1 per 100,000. The examples that you can look at are on page 96. There's example 6.8 and example 6.9 to help you walk through and get those numbers. Newborn mortality rate. This one is a little more complex because there are all these different types of deaths that apply to everything from newborn to infant. There are newborn deaths and neonatal deaths. They mean two different things. There's post-neonatal death, infant death, and perinatal death. So make sure when you're talking about newborn mortality rates, are you talking about newborns, neonatal deaths, post-neonatal deaths, infant deaths, or perinatal deaths? Those 5 types. So make sure you know the difference in those definitions. An example that walks you through it is example 6.10 on page 99 in your book. And I like this one because it actually shows you the formula for an infant mortality rate, so you can compare the two. But it'll walk you through what your newborn mortality rate is. So again, they're different, so watch out for that. And again, researchers frequently use birth certificate data for public health and policy studies. Just FYI. Neonatal mortality rate, the formula for that is up here, as well as on page 99 in your book. This time you want to look at example 6.11 for neonatal mortality rate, different than newborn mortality rate. And then moving on to infant mortality rate, this is also in your book. I want to use example 6.11 on page 99. Let's pretend that that example had also included 2 neonatal deaths in the information. So to calculate infant mortality rate, it's the number of infant deaths, which we said would be that the 2 neonatal, I'm sorry, it should say infant. I apologize for that. Instead of neonatal, draw a line through that mentally and think infant. So you have 3 newborns, 2 infant deaths, and then you have the number of discharges. So according to the formula, we take those 2 infant deaths, that's our numerator. Our denominator is number of live births, which was the 4,270. We do our nice little division there and come up with a 0.5100% infant mortality rate. Sorry for the confusion with there. I'll make sure I fix that moving forward, but that's how you would calculate an infant mortality rate if that 2 neonatal was 2 infant deaths. Sorry about that. All right, so fetal mortality rates. This is a death that occurs prior to the complete expulsion or extraction from the mother. So it would include miscarriage as well as stillbirth. And the way that they typically determine fetal mortality is they do APGARs. If all of the APGAR scores are 0 when the child is born, then it's considered a stillbirth. And again, it's considered a fetal death, not a newborn death, because according to the criteria used, the child was never alive. They're not included in any other death rate other than the fetal mortality rates. They're not included in the hospital, the inpatient rates at all, or the newborn or neonatal or infant, none of that. They're separate, they're fetal. And interestingly enough, in most cases, a stillborn child's medical record is included in the mom's record. It doesn't have a record of its own. The baby doesn't. There are 3 different classifications for fetal deaths. There's early, intermediate, and late. And it's based on the weight of the baby as well as the length of gestation. And most, the common definition for a fetal death is intermediate and late. They typically do not count early fetal deaths in the fetal mortality rate. They're looking at 20 weeks gestation and beyond for a fetal mortality rate. So how do you calculate that? Let's look at page 101 at example 6.12. And it'll tell you that the hospital had 207 live births and 1 early fetal death, 2 intermediate fetal deaths, and 3 late fetal deaths. And you'll notice that when they calculated out, they did not include that 1 early fetal death. All right, moving on to cancer mortality rate. This measures the risk of death for the cause under study in a defined population during a given time period. Looking at page 102 at example 6.13, it shows you how to walk through to get this type of a rate. And again, because you're talking about populations, you're talking about extremely large numbers. All right, and the last little bit here is mentioning cancer registries, which we've studied numerous times before you've gotten to this point. But knowledge of healthcare statistics is an essential tool, especially for cancer registrars, so that they can calculate those rates. And we know all of this about cancer registries, so I won't cover it. All right, that is it for Chapter 6. I'll be back shortly to talk to you about Chapter 7. Thanks.